infected. It's this side of the nail right here, and I'm sure there was probably pus coming from the nail earlier. You can see the dry drainage on the side of the nail here. This is usually very painful for the patients, and it needs to be removed permanently so the nail will never grow back on the side. So what I'm going to do first is numb up the toe, and this is a local anesthetic of 1% lidocaine. And we're going to numb the toe up here. We just put a little on each side here. As you can see, it's relatively painless. The toe gets numb pretty fast with this injection, so now I'm going to be able to put a tourniquet around the toe. And this actually pushes some of the blood out of the toe, as well as acts as a tourniquet. So there'll be minimal bleeding, although there will be some bleeding during the procedure. Now we'll open up this tourniquet so we can see the side of the nail that's affected. And what I do first is free up the side of the nail that's infected, and I'm going to take a few millimeters here. We'll go under the nail plate itself, free it up all the way down in the corner, and as you can see, this goes way down into the corner. And some of the nail is already loose on the side just because of the infection. The infection will actually lift up the side of the nail. So now I'm going to cut the side of the nail that's ingrown. As you can see, it's already flaking apart from trauma to the nail previously. Then I'll take my hemostat and go all the way in the corner and slowly pull the affected piece of the nail out. You can see how far down that's going. You see all that is all nail digging into the skin. And that's all part of the ingrown nail. On the side of the toe, after the nail is ingrown for so long, you get what's called granulation tissue, and this is this proud flesh right here on the side. Eventually that will go down, and the swelling will go down on the side of the toe as well. Now I'm going to make sure that the side of the nail is dry, and I'm going to put a chemical, which is called sodium hydroxide, on the nail matrix. The nail matrix is the area of the nail under the cuticle that makes the nail grow. And as you can see, it's changing color. That just shows me that it's cauterizing the nail cells, and it's also burning the nail cells. This is actually a chemical burn to the nail matrix. Normally, we do about 3 10 to 15 second sticks of the sodium hydroxide in the side of the nail, and you can see as I go there's less bleeding as I do this because it's cauterizing the little blood vessels there. It's also burning the nail matrix, and it's changing the color of the flesh underneath, and that lets me know that the chemical is taking effect. The patient doesn't feel any of this because they're numb, and this is the third stick that I'm doing now. And like I said, it's about 10 to 15 seconds per stick. Now I'll examine the proud flesh and see if there's any that can be removed. And there's a little bit of what's, like I said, called granulation tissue on the side of the toe. I'm removing some of that, cleaning it up a little bit. When this grows out, there will be a straight edge to the nail on the side right here. This flesh will move over this way, and this proud flesh will actually go down in size with time. I'm just going to clip this nail here too. And then I finish it off with some betadine on the side of the toe. And now I will take the tourniquet off. We'll wrap this up. The anesthetic should last about 6 hours or so. When it wears off, There's a little pain afterwards and a little discomfort for the first day or two. The patient usually takes Tylenol, Advil, or Aleve for a couple days if needed. They put ice at the base of the toe. They'll put a gel on the side of the nail twice a day after cleaning it with soap and water, and just a Band-Aid during the day. They won't need a Band-Aid at nighttime. And they're able to do all their activities, including swimming, exercise, the day after the procedure.